Traditionally, we have always rotated restore lenses to 12 and 6 and nudged them a little bit nasally for centration. However, you can see now with VERION, there's no more guessing. We know exactly where the axis is, or the center of the eye, for this lens. We can set that centration on the pre-op pupil, which is what I prefer to do, or you can set it on the visual axis. As you can see here, we can even set it on the intraoperative pupil or the limbus as well, as you can see now. So once we start, and you can see how that moved just very slightly. In some patients, obviously, it moves a lot more. Sponge, please. It will move a whole lot more, but here the visual axis and the pupil center, pre-op pupil, were very similar. So upon removing viscoelastic, as we're doing now, I like to go below the intraocular lens and remove as much of the viscoelastic as possible. This helps in terms of being able to place the lens where we would like, due to the tackiness of the acrylic material and its adherence to the posterior capsule. I have found personally, however, that as much as we would like to think we can place this lens and it will stay, as soon as we hydrate the incision and fill the capsular bag and anterior chamber, these lenses do have a mind of their own and will tend to center on the equator of the capsular bag. Therefore, now instead of just nudging the lens a little bit nasal, we can actually rotate this lens until we find that part of the bag that it centers the best in. That may mean that the foot plates may end up at 3 and 9, they may end up at 4 and 10, but wherever it is, we know it's going to stay there. For instance, right now, this lens has centered a little bit superior and temporal. So what I'm going to do is try to rotate this lens, and since with a block there's not much posterior pressure, I can rotate that lens very easily, not even using irrigation aspiration. So what we've done now is we've moved it a little bit inferior, but it's still temporal. And at this point, our foot plates are almost at 3 and 9 again. So I'm going to continue to rotate that and see if we can't get it to center a little bit better. And now you can see it is centered almost perfectly on the axis. So here the foot plates have ended up at 3 and 9 as opposed to 12 and 6, which we've done traditionally. To me, that's the real advantage of the VERION system. So not only do we not have to mark for toric lenses, here we can be fairly certain of our centration. So I see a tremendous advantage in that. You can see how it's perfectly centered. And again, remember, this patient's had a block, and that has not affected our ability to center the lens, nor would it have affected our ability to locate a toric lens on the intended axis exactly where we want it. So there we are. That's our end product with a perfect capsulotomy and an intraocular lens that is centered on the preoperative pupil.